Welcome! This presentation, Intramuscular Injection Mastery, is designed as a clinical skills training for both nurses and paramedics, focusing on the essential techniques for safe and effective administration. We will begin with an introduction to intramuscular, or IM, injections. This section provides the foundational knowledge necessary to ensure safe practice in a clinical setting. Let's establish the core principles of IM administration. By definition, it is the delivery of medication deep into muscle tissue. The therapeutic use of this method relies on the systemic absorption of drugs via the muscle's vascularity. Mastering this is a critical skill, absolutely essential for all practicing nurses and paramedics. We will now proceed to the anatomy of key injection sites. A thorough understanding of the muscular and neural landmarks is fundamental to performing this procedure correctly and safely. The primary injection sites we will cover are the deltoid and ventrogluteal muscles. The deltoid is located on the upper arm, about 2 finger breadths below the acromion process. The ventrogluteal site is accessed by identifying the greater trochanter and the iliac spine. A key difference is that the deltoid's volume is limited to 1 to 2 milliliters due to its size, whereas the ventrogluteal site offers the advantage of being a large muscle with minimal risk to nerves or blood vessels. Another critical site is the Vastus Lateralis, located in the middle third of the thigh's lateral aspect. This site is particularly important as it is considered the safest choice for infants and young children. Furthermore, for any patient receiving repeated injections, proper site rotation is a crucial principle to prevent tissue damage and ensure medication efficacy. Next, we will discuss the essentials of equipment and preparation. This phase is critical for ensuring you are fully prepared to conduct a safe and successful injection. Proper syringe and needle selection is paramount. The needle gauge is determined based on the medication's viscosity and the patient's physique. The needle length is chosen according to the specific injection site and the amount of adipose tissue. Finally, the syringe volume must be selected to allow for accurate dosing and to accommodate the prescribed medication volume. In the final steps before administration, we focus on medication and patient preparation. First, medication verification is non-negotiable. You must uphold the 7 rights of administration. Next, ensure proper site antisepsis by cleansing the skin thoroughly. Finally, clear patient communication is vital. Explain the procedure and ensure their comfort and consent. We will now move into the practical application of IM injection administration. The following section will detail the step-by-step technique required for an effective and safe delivery of medication. We will now walk through the precise injection technique. First, to prevent medication leakage, we utilize the Z-track method for skin preparation. 1, 2, 3. The needle is then inserted swiftly at a 90-degree angle. Following insertion, an aspiration check is conducted as per policy to check for blood return. Finally, the medication is delivered slowly and steadily into the muscle to ensure proper absorption and minimize discomfort. Following the injection, post-injection care is critical. The needle should be withdrawn smoothly, and the safety device must be activated immediately. Apply gentle pressure to the site with a gauze pad. It is important to avoid massaging the area. 11. Concluding the procedure, thorough documentation is required, including the drug administered, the dose, the specific site, the date and time, and the patient's response to the administration. 7-18-20. To mitigate potential injection complications, several preventative measures are essential. To avoid the risk of nerve injury, it is crucial to use the correct anatomical landmarks for injection. 22 hematoma formation can be prevented by carefully avoiding any visible blood vessels. Strict aseptic technique is non-negotiable for infection control. 23. Furthermore, ensuring the correct needle depth and practicing site rotation are key strategies for abscess prevention. In summary, let us reinforce the essential principles of intramuscular injections. Key takeaways include the importance of proper technique, diligent aftercare, and proactive complication mitigation. Skill proficiency is not a static achievement, but is maintained through continuous learning and dedicated practice. Ultimately, our collective priority is to ensure patient safety, which is the cornerstone of effective care delivery and positive patient outcomes.